Very much for that sexy introduction. The topic given to me by Jyoti is managing ED without drugs. Now we all sitting here, who wouldn't like to get cured of any ailment without drugs? See, what I have seen in my 4 decades of practice is that patients hide taking Viagra or any medications when they are performing sex, They don't want to show it to their partners that they're taking medications, because they feel that their manhood is, reduced or something like that. But anyway, in next 15 to 20 minutes, I'll give you some nuggets of wisdom and something revolutionary which is today seen in the practice or which is available to us to give to our patients who can manage erectile dysfunction like thing, which 82% of men with ED don't talk about it. They remain in silence. They will be able to have good enough sex, include by even telling their partners what is to be done. So with pranams to God and thanks to my teachers, Dr. Deepak, Dr. Shashank Joshi, Prakash Kothari and O.P. Kapoor, I beseech them to bless me always. My talk today is because every human being has a right to a healthy and satisfying sexual life. We are in the world of intelligence, artificial, but stupidity will always be natural. We've been seeing this so commonly. All the same, today intimacy is ageless. But to ignite intimacy, we need to have strategies of mind and body to have optimum sexual pleasure. The concept of sexual health has now taken a new role, Women are not bothered about the financial insecurities which were there in the past. Today they are earning equal and more to men because of being empowered. So what else they want? This is what we should understand. In men, we know the sexual dysfunctions, among them ED is so common. What happens in ED is there is a reduction in the blood flow in the sinusoids. Okay, there is because there is no relaxation and either there is no restriction or whatever it is. So in fact, ED can be easily called as penile attack or penile angina. So reduction in the blood flow, you got to remember this. And 4 types of patients, diabetics, obese, hypertensive and dyslipidemia, all have reduced blood flow. If your patient with diabetes walks in, imagine you must take into consideration that he has erectile dysfunction, even if he is obese or hypertensive. So when you look at the penile corpora cavernosa muscle and the endothelial lining, in the normal endothelium, endothelial nitric oxide synthetase produces nitric oxide which enters into the cell of the corpora cavernosa, converts GTP into cyclic GMP. This cyclic GMP relaxes the smooth muscles and allows the blood to flow inside the penis. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So today when we look at the armamentarium, what we have is PDE5 inhibitors in the form of sildenafil, tadalafil, vardenafil, udinafil, and now new kid in the block is avanafil. But to reach this stage, please understand, you need nitric oxide. If you do not have nitric oxide, this stage will not come. So what people are doing, they're taking PD5 inhibitors, which is of no use. It's not curative, it's not even therapeutic. They get, and 50 to 60% patients don't respond to these drugs. So when you look at diabetes, advanced glycated end products and oxidative stress leads to molecular alterations, ultimately leads to ED. So there is definitely a link in type 2 diabetes, even in type 1 diabetes. We have lots of causes of ED, but what I feel the most important thing is, if the penile nerves stimulate, vessels circulate, muscles facilitate, and hormones regulate, everything can be fine. When we look at these metabolic syndrome like hypertension, all these produce structural and functional changes, ultimately leading to reduced inflow and excessive outflow, which leads to ED. So our body is a biological machine in action. Diabetes and pre-diabetes is hyperinsulinemia and inflammaging processes, is a sexual health tsunami of our century. It is a manageable metabolic malignancy. So how do we treat today? We have oral drugs, injections of papaverine, vacuum therapy, intraurethral drugs, and if all these fail, we send our patients for the implants or surgery. But all these things are most important, counseling and lifestyle. We have 50% patients don't respond to it because of the various side effects and contraindications. These side effects include headache, flushing, nasal congestion, nasopharyngitis, dyspepsia. Serious side effects like greenish bluish halo, increased choroidal thickness, a lot of other complications in the eye. The subfoveal choroidal thickness becomes 505, even with 100 mg of sildenafil. If a woman takes even 25 mg, her subfoveal choroidal thickness becomes more and visions are affected. Lots of studies to prove. The worst side effect which we have seen is these patients also have a susceptibility to seizures, which don't become better with the normal anti-seizure drugs. Even there are patients who've got malignant melanoma, though incidences are less, but yes, it has been there. So we have limitations to PDE5. Today these PDE5 inhibitors are used only as a recreational drugs. We can't give it to patients who are on nitrates, and 50% patients don't respond to it. Certain medications are. So what do we want? The unmet need is they want something which is efficacious, which does not affect their self-esteem or they call distress. We know that it is the nitric oxide which is important. No point in giving them PDE5 inhibitors or giving papaverine in the penis or implants, etc. But nitric oxide has to be replenished. So the ED, though being an endothelial dysfunctions, the therapy should target restoration of endothelial functions and restoring nitric oxide deficiency. The risk factor of all risk factors is endothelial dysfunction. Now, even with slightest rise of blood pressure, slightest increase in glucose and slightest increase in LDL or triglycerides will have the endothelial dysfunction. So we need to understand this and we need to restore the endothelium pump, because endothelium derived nitric oxide is anti-atherosclerotic and anti-thrombotic molecule. That's what is important. The science behind nitric oxide is that it expands the blood vessels to an average of 26%. In most of the studies it has been proved. But most of the patients reduce, the nitric oxide reduces as we age. Nitric oxide is also required in our lungs for exchange of gases. Loss of nitric oxide is the cause of atherosclerosis. The discoverer of nitric oxide got Nobel Prize, the three brilliant scientists. So this is a clean artery, okay, and this is how the blood flows inside, and this is all because of nitric oxide. We know ED is nothing but reduced blood flow, so we need nitric oxide. Brian
Oxidative stress and immune dysfunction. Nitric oxide corrects all of these. So how do we biohack to improve nitric oxide? The earliest stages of vascular inflammation are when monocytes and neutrophils start sticking to the lining of the blood vessels. This is the action of the spike protein. It activates platelets. The blood vessels become like Velcro. And we were able to visualize this.
This is a real life study.
Real-time intravital microscopy of an inflamed blood vessel. You can see the monocytes and neutrophils have stuck. There are a lot of cells that have already migrated through. So this is a heightened state of vascular inflammation from a poor diet. If we give that same atherogenic diet, but we restore nitric oxide production, the blood vessels are more dilated, the monocytes and neutrophils don't stick, they don't migrate through.
So the bottom line of normal sexual functions is, if you do not have nitric oxide, you cannot have sex. So erectile dysfunction today is nothing else but nitric oxide deficiencies. So let's think deep. How do we get nitric oxide? I have got hypertension, so my endothelium is gone. I've got high blood pressure, high glucose. So how do we get nitric oxide? Do I live without sex if I don't have nitric oxide? Well, there are two production pathways. One is, of course, the endothelium, which produces 50% of the total nitric oxide. We have a diet which is nitrate-rich diet in the form of beetroot, green leafy vegetables, nuts, pomegranate, watermelon. These nitrate-rich foods, when you chew them, with the help of a salivary microbiome, gets converted into nitrite, and when this goes into your stomach, it produces nitric oxide. So this is the best way to get nitric oxide. Also, we know that if you use fluoride toothpaste or mouthwashes, Listerine and all that, they spoil the microbiome of the saliva, and hence this nitric oxide production can be reduced. The third way of getting nitric oxide is our nasal sinuses are filled with nitric oxide. So deep nasal breathing can also produce nitric oxide. So that's the third way to get nitric oxide. And the fourth way, which is proven beyond doubt, the effect of Omkar mantra. Just recite Om, you will have nitric oxide productions. High fiber diet has been proven to improve vascular endothelial functions. Even ADA has proven this. So now let me come to the best part of my talk. Do we have something to give to our patients? And it's been studied. What does this stimulating gel contain? It contains ethanol, propylene glycol, glycerin, carbomer, and none of these are chemical compounds or drugs. What does ethanol do? It increases the cutaneous penetration. It is an enhancer. Glycerol is a preservative. And of course, carbomer, again a buffering agent, microbiocide and spermicide. And potassium is a precursor of soft and liquid soap. We all know about it. So what does this do? When you apply this gel on the glans penis, this causes rapid cooling, which is followed by a warming effect. So cooling and warming. When you have anything which is cooling, it constricts the blood vessels, and when suddenly you are warm, the diameter of the blood vessels increase, and there is influence on the autonomic nervous system, neurotransmitters, and there is increased blood flow and erections. So it is to be applied before sex, 5-10 minutes before sex. It's a very small tube. Unscrew the tube and extract the complete pea-sized gel. Apply the whole tube on the glans penis only. Your partner can do that as an act of foreplay and massage it for at least 15 seconds. What does it happen? Once you apply the gel, because of its volatile and non-volatile components, it enters into the epidermis and dermis. It produces a rapid cooling effect, and then there is a recovery warming effect and stimulation of the nerve endings, and then there is a nitric oxide production. So this is the best way to get nitric oxide without giving your patients any drugs. Okay. We did study at our JJ hospital with just 60 patients. We want 5 units increase in the score. That's how we consider it to be very positive. So we have sexual encounter profile. We have 2 questions. Were you able to insert the penis in the vagina? Yes. Were you able to last long enough to have successful intercourse? Yes. This is our studies. We did for 12 weeks, 4 weeks, 4 and 8 weeks, and at 3 intervals we measured everything and we found out this. 60% of our patients achieved erection in 10 minutes. Even you will not get it with any drug. So this is how. And it was an excellent safety profile, as only 2 patients had headache. 1 patient had little burning. No, nothing to the female, nothing wrong happened to her. So my take-home message is that when we took oath, we said primum non nocere, we should not do any harm. Even if you give your patients PD5 inhibitors, he may get headache, he may get greenish bluish discolored. If you give him tadalafil, he may get backache. If you give him pepaverine, you have a risk of he getting priapism. If you put him on implants, it's expensive, and if implants fail, it's again his money is all lost. And we all know diabetes, friends, is an inflammatory disease. It's not a common disease. We are all into pro-inflammatory stage. Anything going wrong in our lifestyle will go put our body into the inflammatory states. And muscle is anti-inflammatory, fat is inflammatory. So to rekindle the sparkle of life, we must build muscle and burn fat. We've been treating ED for more than 20 years, but none of these therapies reverse the pathophysiology of erections. PD5 inhibitors don't increase the nitric oxide. Papaverine doesn't increase the penile implants don't increase the nitric oxide. So, and as we age, we have something called as telomeres, which are nothing but genetic material. Telomeres shorten with age, and progressive telomere shortening leads to senescence and apoptosis. Shorter telomeres have also been implicated in genomic instability and oncogenesis. Older people with shorter telomeres have 3 to 8 times increases to die of heart and infections. Shortening of telomeres is within our reach today. We can shorten this telomere, or we can elongate it by fasting. Caloric restrictions will produce sirtuins, which are present in the corpora cavernorum. These are anti-aging genes which can be activated. A lot of studies to prove autophagy. Again, by fasting, you can increase and hormesis. This is you stress your body a little bit more than that, and that's how it is coming. So 3 things which we need to learn is sirtuin pathways, autophagy, and hormesis. So the best management for ED without drugs is restore endothelial dysfunctions, mitochondrial dysfunction. We have a beautiful drug called imeglimin which you can give to your patients, and nitric oxide deficiency, reduce inflammatory triggers, reduce oxidative stress, and replenish nitric oxide with diet and stimulating gel. So lifestyle modification will reduce the pro-inflammatory milieu, insulin resistance, oxidative stress, and endothelial dysfunction, which will have improved well-being and reduced burden. Dr. Linus Pauling, who won 2 Nobel Prizes. Who gets Nobel Prize? This brilliant scientist, when he received his second Nobel Prize, he announced to the world that nearly all diseases can be traced to a nutritional deficiency. We have enough studies to prove that even diabetes, even hypertension, even dyslipidemia can be managed with nutrition. So the art, and give me one more minute, the art and science of sexual fitness is based on what you put in your body and what you do for your body. Detox yourself from dopamine, recharge your brain, refresh, detox from mobile, give 2-3 hours, holiday of the mobile. Don't watch a lot of social media, don't watch a lot of TV. Detox from, junky food, smoking, sugar, porn, alcohol. Control your dopamine before dopamine controls you. You need to be respecting your partners. You have issues, take treatment, don't deprive them. So my last slide, there is no law which says you must age. Don't blame your genes. You can modulate your genes. You can reduce the wrong expression of your genes. Our body has a capacity to stop senescence. If you are able to have sex, which means your coronaries are clean. That's what it is. This is my book, Sex Has No Expiry Date. My last slide, friends. ED is common in diabetics, is a tip of an iceberg, is the earliest marker of coronary artery disease, is endothelial dysfunction. I call it diabetes type 5. Lifestyle modification, reversal of metabolic syndrome is not a myth but a reality today. For ED today, beyond PD5 inhibitors or any drugs, we have a stimulating gel, which is clinically proven to be safe and effective with no side effects. ED hence is a erectile dysfunction without drugs. If you do so, friends, sex really has no expiry date. Thank you all for your love. This stimulating gel will be launched in August by Zydus by the name of Penegra XL. It's a very small tube. In US, it is available as Eroxon. Little expensive, around $29 for one tube. But in India, it will be a little cheaper. So this is the best treatment for ED without any drugs, irrespective of whether he has diabetes, hypertension, or whatever.
Thank you, sir. It's always unique. The way you present the topic, it's different. So, any questions from the audience? Any contraindication for this topical agent?
No, it doesn't contain any compound, medical compound at all. It contains all which are there in preservatives which we use in our day-to-day life.
Those who are hypersensitive?
No, nothing. No hypersensitivity result at all. Here you don't have to hide also, just like you apply lubricants, you can tell your partner to apply this for you. So there is no fear or guilt or anything like that. Like how they have when they take Viagra. Most of the men have it. They hide and take it. So this is not there. But it's safe, it's safe because it does not give you any side effects.
How long it will last?
At least for 2 to 3 hours.
Sir had a question.
But none of these ingredients are costly. We can manufacture.
You can do that. You can do it. Try do it. Do it.
It's not about alcohol.
Yeah. Yes.
I'm sure
It's US FDA approved and sold over the counter. Imagine that's the safety part of it.
So there's no patent, which means anyone can come up with it.
No, it is patented, of course. Some company in US has patented it, and the same thing has been bought by Zydus today from them. So they are marketing it now. They'll be launching it in August.
Costly is this. Is it a standalone product or a failure?
Huh?
After the failure of PD5 or a standalone?
You can use it. Nothing wrong. Nothing wrong.
One of the components is pesticide effects.
Huh?
One of the components that gel is pesticide effects.
Yeah, it is because see, this spermicide and all these things are there to avoid getting pregnancies, That's why it is there.
Sir, how does the charn of home help in?
How much?
You said that the chanting home, recitation of home.
See, Om is a sacred formula for all of us. If you recite Om, your lungs become clean. There is a lot of nasal breathing involved in it, in that humming. And nasal passages are full of nitric oxide. Lots of studies proven beyond doubt. Yes.
Sir,
Fenugreek is very good in patients who have low testosterone. All diabetics are hypogonad. They have low testosterone. Now we are scared to give them testosterone replacement therapy because of the fear of prostatic issues or heart failures. We can't give it to younger patients because of azoospermia. Fenugreek has a chemical composition exactly like testosterone, and it produces more free testosterone, which is required for desire, and it's safe. It's available as 1 gram by Hetero Pharma. You can use it by the name of Trigotab.
I think due to lack of time, we'll avoid further questions.
No blindness, but difficulty in vision definitely. Once you stop it, it reduces. That's what it is. There is a study published by the Indian Psychiatry Society. A person took 14 years tadalafil. And when he developed this thing, he stopped it, and he developed it after 14 years. And then he became better when he stopped it.
Thank you, sir. Thank you. So we'll move on to the next